Well, we thought today was appropriate because it's April Fool's Day, and we get so many questions all the time from patients, and we get phone calls too, not only just asking questions about certain things that we have in our practice, but other places that they have been to get the same things that we do. So we're always asking questions, and I think it's appropriate that we talk about how not to be fooled by other practices, our practices or centers, because if you look in the magazines these days, there's a lot of, especially health med spas, popping up on every corner. Every dentist has one. Every somebody that's not even in the medical profession has one. So you have to be really careful. So we wanted to do something so we can clarify all of our what we do here and what's out there, and then open it up for everybody to ask questions, because I'm sure you all have questions or you wouldn't be here. So just feel free while we're doing this whole presentation to ask anything you want, clarify something that's going on. We have basically 4 topics to cover, but we can actually just open it up after each one. Okay. First of all, I hope did anybody here see that special last night with Oprah Winfrey?
Yes.
Yeah. We sent a social media message out. It's Kelly, did you say you found some of it, excerpts on YouTube?
It's on Hulu.
It's on Hulu too? Okay, well great. Because I have to give, I've always loved Oprah Winfrey, but you have to get her credit because she now is putting things out there like menopause. And they called it the menopause revolution, which is true. We need to have a revolution after having so much time in the dark with menopause or misconceptions about hormones in menopause. So I really give her a lot of credit. I give Halle Berry, who's really come forth. A powerhouse, and admitting menopause, and this is what I do, and this is what you need to ask for. So, and this is for you too to ask questions about hormones, because we face these questions all the time. So really there's not any falsehoods out there about hormones, but these are things that you need to look out for. First of all, one size does not fit all. You're different than you are, and everybody's different, not only in the type of hormone they want, the dose, but also the delivery system. So beware of the clinics that are out there that are doing just hormone pellets anyway. That's not in your best interest because that may not work for you. They also will tell you that, or they don't tell you what they do in most of these hormone clinics that just do pellets. They're usually franchises. When they're a franchise, that means somebody else is giving them their actual pellet, and they're plugging you into a formula. They're looking at your labs, they're looking at your age, they're looking at your height, your weight, and all this other stuff, and then they're putting the dose in based on that. It's like an algorithm for hormones. Well, if you're like me, I don't want to be put in an algorithm because, well, algorithms work for a lot of different hormones. Welcome. A lot of different things in our lives. They don't work for individuals. So talking to the patient, seeing their concerns, checking their levels, and just trying to base your hormones on that. And not only just doing pellets, but offering either topical gels or creams, offering injections, things like this. Kelly, how many pellet patients do we have? Not pellet patients, but injections.
So we have 30 patients a day.
30 patients a day getting testosterone injections. We have another large population getting topical creams of testosterone. And we have another population getting pellets. So we try to accommodate each individual when it comes to hormones and take what you're feeling, what you're experiencing into consideration, and not just trying to put you in a formula. So that's the myth with hormones, is one size fits all. It's just not true. And if you get on the internet, basically that's all they'll tell you. It's not one size fits all. The next question that we have Come on in. Welcome. The next question that we get, the most frequently asked question is, do hormones cause cancer? I don't know, did Oprah address, I've recorded the program, did she address that?
She did address that.
Good.
And she talked about how when they first did the study, they stopped it because it was showing that it did cause cancer. But then when they found out it didn't cause cancer, nobody talked about that.
Right. Right, and so that's true. So that's the biggest question I get too, is like, am I gonna get cancer because I'm taking hormones? And I hate to say this, but there's a lot of physicians out there that don't know hormones that are telling women to stop or not start because you're going to get cancer, which is not the truth. I heard this lady speak, her name's Dr. Jen Simmons. I heard her speak at a meeting, and she's a cancer survivor and was a breast cancer surgeon. She has a book, A Smart Woman's Guide to Breast Cancer, and she said, when I heard her speak and what I heard her talk about, that was probably the biggest aha moment I had, because she was saying everything that I've always said. Disease, believe that or not, heart disease, but what they also do is they protect your bones. So what happens if you have to be in assisted living, or why would you go to assisted living in the first place? Because you've fallen down and broken your bones. So hormones in their natural state are very, very protective when it comes to bone health, cardiovascular health, mental well-being. A study just came out saying that hormones now extend longevity. And I think that's probably the most important thing right there. And extend your relationships with your spouse, your partner, or whatever. So what she says about hormones is that what happens when you have breast cancer, you've got estrogen, progesterone, testosterone receptors all over your body, even in your pinky, right? So when you get breast cancer, you have a proliferation of hormone receptors in that cancer. And so of course, estrogen is going to feed it. But did it cause it to be there in the first place? Absolutely.
Didn't cause it, but we have to stop it after.
Well, you have to, but I have several patients with breast cancer now going back on hormones.
Really?
Yeah. And some physicians out there in West Clinic are actually talking to their patients about it. So it's not a no-no, but you don't take it back right away.
No.
Yeah. Yeah.
Under supervision of a physician.
Right, under supervision. And,
yeah, of course.
Right. So it's not an absolute no, but it's a great, it's something, I always say to my patients, hormones are about quality of life. If your quality of life is you sitting there worrying about getting cancer every day, that's not a quality of life. So I would not recommend hormones to you.
Yeah.
But look at your quality of life, get all the information, get Dr. Jen Simmons' book. It's an amazing book. I've read it. What's that?
I'm going to get it.
Yeah, it's a great book. And
What book was that?
A Smart Woman's Guide to Breast Cancer with Dr. Jen Simmons. It's a fantastic book, but not only does she address hormones and breast cancer, she talks about lifestyle and how 80% of cancers are environmental. So you've got to take stock of what you're putting in your mouth, the air you're breathing, and everything else. So it's just not about, it's not about hormones. It's about lifestyle, basically, and environment. So, anybody have any questions on hormones?
So what is the, I guess, the gap from functional medicine and Western medicine, and like why are these, I guess, doctors, a lot of gynecologists not catching up to this? Because
I think they just don't want to learn any more information.
okay.
I mean, I hate to say
I
that.
know you can't. I mean, there's no why. It's sort of a, not even a question, but it's just, it's amazing to me because I happen to be on a bunch of hormones and whatever, and I went to my doctor and she freaked out when she saw my levels.
Yeah, I know who you are.
Huh?
I know who you are now, Shelley.
I mean, it just, I feel
think
great.
it's, yeah. Well, no, and that's the whole purpose, but I think what happens is and I've seen, especially since the pandemic, but it's been going on for a long time, I happen to see this trend where certain doctors are unhappy and they just don't want to learn anymore or do any more research or read that or take any classes. And I was always taught, and I've always wanted to keep learning. And I went the distance, and so did my partners, to do this. To be able to give better advice and the most current. I remember, I don't know, when did the hormone apocalypse in 2002, I think that's what it was. I mean, that freaked me out. I went to Mary McDonald. Where's Mary?
Mary.
Can't see. I went to Dr. McDonald and I go, are we killing our patients? Because that's how shocking it was. I mean, it was the apocalypse of hormones because we were asked to be on panels and do all these talks and stuff like that and digest all this information that was coming out when it first came out, because it was done. The study was done incorrectly in the first place. How can you have 16,000 women and be able to control it? I remember I had a patient said she was on the WHI. She goes, "Can I have hormones?" And I said, "Aren't you on the study?" She goes, "Yeah, but I'm miserable." But their average age of the person on that study was 60. So if you're going to have heart disease, it started 15, 20 years before that. It just didn't happen. So the relationship between it causing heart disease is ridiculous. Then they had them on a progesterone that was very toxic. It wasn't a natural progesterone. That we even saw videos where the progesterone, when you would shoot them with Provera IV, and they unfortunately did this on monkeys, it closed up their coronary arteries. So that was pretty remarkable. And then you've got Premarin, which is not a bioidentical hormone that is not natural to your body. And why put somebody that's 60 on hormones all of a sudden, unless they're symptomatic, but you've got to evaluate the patient. So you've got to look at their history, you've got to talk to them, and am I against somebody at 60 being on hormones or starting hormones? No, I'll put them on there, but you do start them out slowly.
One of the sponsors of that study was Wright Pharmacy, which had that drug and stuff, so.
Right, so they got screwed.
And I will say recently, ACOG came out of the American College of Obstetrician Gynecologists with an article about review of menopause and stuff and advocating for natural hormones, estradiol, progesterone, micronized progesterone, and talking about the flaws of this study.
Well, why did they just come out with it 20-something years later? I mean, that's...
But because they're getting smarter, you know.
Yeah, well, you know what? I don't have time to wait for that kind of smart, you know?
But I want these ladies to know that they re-looked at the data and they revised what the initial studies had said, and they understand that women who are transitioning into the menopause do need to consider hormones to help with their heart and bones and, you know, quality of life or whatever.
Right, and that's totally true, but they're a day late and a dollar short coming out, so maybe your physician will read that magazine now.
Well, she actually was very open, and I gave her the book that I read, and I have a good book.
Was it The Menopause Brain?
The Menopause Myth. Okay. It's Wise and Well.
There's a bunch out.
Yeah, there is. It's called The Menopause Myth, and it was so she took the book. She's like, I'm going to read this, but she didn't agree with the estrogen level I was at. So I don't know what
it's an individualized thing. You know, you've got to talk to somebody and see how they feel. But who was on that Oprah special is it Marie Claire?
Maria Shriver.
No, there was a...
Marie Claire.
Claire.
A new book.
Yeah, she's got a book, and then the one I like the best is called Menopause Brain, by a PhD who actually did studies. This is what's remarkable, and I hoped if she was on there she would talk about it, but I don't think she was on there. She's a PhD that works at Mount Sinai in the Alzheimer's department, in dementia, okay? And she's doing a study on hormones, right? So what she did was she got a bunch of women over 10 years to sign up, starting at the age of 40, and did MRIs of their brains every year, tracking their hormone levels. Do you know your brain shrinks without estrogen?
They
Yeah.
brought that up on Oprah.
Yeah, your brain shrinks. It's pretty amazing.
So all these crazy people in the streets, they need estrogen here.
It should be the water, no. But anyway, I mean, you've got to look at the science now that's coming out. And now, I hate to say this, estrogen or menopause is coming back into fashion, but at least we're talking about it in a logical fashion and not what we had in
It's not
2002.
taboo to talk about it anyways. Women,
Yeah.
after 50, you should feel like that, and you were shamed if you express your
Right.
frustration with all the above, you know, like.
And look, we got a hot flash.
All
So-
the time.
Yeah. So the other thing too is it's not a myth. Now, before I saw that hot flash, I had it in my brain was estrogen's low. I don't know what. But you've got to consider the source of where they're getting their research.
That's
So,
what we're talking about.
and
yes.
in that book I was telling you about, Dr. Jen Smith, she said, or Simmons, she thinks that blaming estrogen for cancer was also a big pharma thing because that's when they started coming out with the anti-estrogen medications, tamoxifen and all that.
Yes.
Which, people don't know this, tamoxifen's on the carcinogenic list.
Cause it's uterine cancer.
Yeah, uterine cancer, on all sorts of things. So, bone loss. So, it's on a carcinogen list. So is estrogen. But it's estrogen. They're not saying which type it is. But because of that study, they put it on a carcinogen list. Which,
So talk about estrogen and progesterone and which one you need and what the difference is. For example, if you don't have a uterus, do you still need progesterone if you have ovaries?
that's a tough question because a lot of people, some people feel bad on progesterone. So technically, you don't have to be on progesterone if you're having an estrogen, because what we're trying to do with progesterone there is break up the unopposed estrogen so you don't get uterine cancer and other issues. But progesterone helps with brain fog. It helps with sleep. It's a good balance. So I consider that a personal choice. Would I recommend it in somebody with a hysterectomy? A lot of times, yes. But if they don't want it, I'm not going to force them to do that. But you have,
What are the benefits of it if, for example, other than that, are there benefits, I mean, you've talked about the benefits, but what are the negatives of taking progesterone if you don't have a uterus?
there is no negative unless you feel bad on it.
Okay.
Because they have shown that brain fog is helped with progesterone as well. So you've got, and it's studied too that there is benefits for dementia when you have estrogen. It's good for your brain. And she kind of proved it, what happens to your brain, without hormones. What's that?
Next topic.
Okay, next topic.
We like this topic.
Eli, this doesn't work. That works now, the arrows work. All right, weight loss injections. Is this a quick fix for weight loss? What do you guys think? Yes or no?
No.
Yeah, I don't think so.
No.
Good, because they're not. And plus, you have to consider the source. So there are a lot of myths out there about weight loss injections. I'll just start out telling you what is a weight loss injection? Well, you've got really just two types now out on the market, sold under 4 names. But they are peptides. There are 4 peptides, or they're peptides, which means there's 4 amino acids in each Wegovy, or not Mounjaro, tirzepatide or semaglutide. What's a peptide? It's a bunch of amino acids, 4. What are amino acids? What your body is made up of. So if you think about them as like a lock and a key, peptides are the lock that unlocks this key in your body to create another action. So there are peptides out there for everything, but a lot of times you can't find them because the FDA is taking them back like they've done with semaglutide and with tirzepatide. So you can't kill anybody with a peptide. But peptides will unlock the GLP-1 hormone, and that's what causes you to feel full and your brain to say, I don't want anything more to eat. Now, sometimes that's not enough in some individuals. Maybe you have some underlying issues. If you're insulin resistant or you're pre-diabetic, a lot of times this can be a problem. And you're going to need extra help trying to lose the weight, or you're slower to lose the weight. So those are the big myth, is it a quick fix? No, it's not a quick fix, because we recommend, and our Melanie and our Stephanie over there who run our weight loss clinic, they're constantly talking to you about your lifestyle. Because you can get, I had a patient today wanting to know if she can get is there a pill that fixes all this? And I'm like, no, there's not. You've got to. She goes, but I'm tired all the time. I said, well, get out and exercise. Look what you're eating. Look what you're putting in your mouth. If you're in that Chick-fil-A line every day, then there's a problem. There's a big problem, because you're not going to lose weight that way. So it's a whole lifestyle change. It's looking at your environment. Not only what are you putting in your mouth, what are you doing in your body? Are you getting enough exercise? Are you living in a toxic environment? That can really affect it as well. So it's not a quick fix for weight loss. Does it affect your GI system? Yeah, it does. It affects it in a way that tells you you're full. Will it slow down sometimes your GI system? Yeah, you'll get constipation. But they just came out with a big article on psyllium husks, fiber. We're not getting enough fiber in our diet.
Our patients are.
What's that? Your patients are.
Can you join her? Can you say your experience with
Yeah.
the patients and what they tell you?
So
Let's
just
go
remember fiber and whole psyllium
Go
husks.
somewhere else from internet.
Go closer to Dr. Murrmann so the microphone can pick you up.
Melissa, go.
I think the microphone picked me up in the parking lot. One of the things that we see with people that have been on a peptide or an injection from somewhere else, when they come here, they've gotten off of it and they gain the weight back. You really have to monitor. It's not about losing weight. It's not about what the number is on the scale. It's about changing the composition of your body, decreasing the level of fat and building up your muscle mass. And we do that by monitoring your protein, by doing strengthening exercise over time. We don't start all of these changes at once, because we're very big on giving you one thing to change at a time, bringing you back at the end of that month, measuring your results, because when you see the results tied to that behavior, it becomes a sustainable behavior. I'm not going to eat air and ice and lettuce for the rest of my life if I'm still going to be fat or feel like I'm fat. But when you come in, we put you on our body composition scale, and you can see that your muscle is increasing, your fat is decreasing. We verify that with you by how are your clothes fitting. Oh, I've dropped 2 sizes. That's what we want to see. What we really like to see is that your weight doesn't change as dramatically as your body composition changes, because that becomes sustainable weight loss.
It's about doing it the healthy way.
Exactly.
The right
Changing
way.
the composition of your body and building the muscle. And from day one, we put everybody on high fiber, 26 grams a day, bare minimum, and high protein, so that we're preserving your muscle. But fiber it's not only good because you don't get constipated, it's great because it slows down your digestive, it stabilizes your blood sugars, it's
Lowers
a
your
probiotic.
cholesterol. Lowers your cholesterol.
Lowers and toxins in your gut.
It pulls it out.
And it's
Helps you convert your,
I can't say enough about that.
your
Yeah.
food into usable energy, where it helps keep it from getting stored right to fat.
I have my dog on fiber. I am not big
I do
on
too.
fiber.
I've got my dog on all brand cereal, like a sprinkle of it in the morning.
And what sets us aside from the other places, because there's clinics all on every corner, and online's big.
Cheap products
And what we found is you don't know what you're getting. You don't know what it's compounded
That's why I
with.
said consider the source.
Yeah, you don't know what the strength is. I've had patients come in and say, well, I started this, ordered it online. I've had several come in, they're deathly ill. They tried to get back in touch with the doctor or the pharmacist that prescribed it, can't get in touch with them. And most of the time it's just
And then the dosing.
Yeah.
So it's cheaper
totally different.
because it's weaker.
And you're having to take double of what our dose is. So your long run, they're not saving money, they're sick. They're getting reconstituted powders that probably came from China.
Once you start, can you stop that? Or is this, or once you start those drugs,
Yes,
That is the goal.
That's another myth. people say, oh, you can't ever come off of them.
Right.
Yes, that's our goal, is to get you healthy so you can sustain it. It's maintainable, okay? By getting rid of the fat. And that's the whole purpose of it.
Well, I think the other thing too is rearranging your mind.
That's right.
Rearranging your mind to what your old habits used to be and embracing the new habits.
And the big thing, and it's not as complicated and hard as it sounds. We break it down and make it simplified, where you can enjoy. You know, you still can enjoy eating. It's just all about
What you're putting in your body.
how you're fueling your body. That's what it boils down to.
And we have some exciting news coming up probably in the next month.
Yes.
About an alternative that helps your brain think differently when it comes to food. What's FDA approved that helps your brain think. So it would be a good way, if you've lost your weight, to kind of help you rearrange your thinking, put it that way. So we're not going to break it out yet, but
And one thing about our program, once you are a weight loss, management, patient, you're in with us for life. We will not charge you every time you come and consult with our 3 nurses here, Melissa, Stephanie, and Melanie. We didn't introduce you ladies. And, even if you are off the medication for a year and you will gain a couple of pounds and you're gonna come, so they're your coach for life, as long as you started the program with us.
Yeah.
At no cost.
right. And then again, like we say, consider the source. Not only who you're getting it from, but where they're getting it from.
That's right.
Because I think that's, ask them to see the vial if they're injecting you with something. If it's got a foreign writing on it, like Chinese, and it's not a good thing.
And some of them don't even have foreign.
Yeah.
Well, and
one
one of
that
the other things we're doing, I'm sorry, I may
No, go
interrupt
ahead.
you, but I'll forget, is I have patients that said they would pull up their injections and give them like 4 or 5 syringes.
Yeah, in a bag.
full. Well, this medicine is in a glass vial and and sometimes it's dark and opaque, but it has to be temperature controlled. We can't really say that, if it was stable in plastic, believe me, they would use plastic because it's cheaper. So pulling that out into a plastic syringe and sending it home with someone is a concern for me.
That's right. Me too. Especially when you don't know what's in it. And they literally will bring syringes in from other places and they'll be like, what is this? And I'll look at it and I'm like, I don't know. Maybe a B vitamin, I couldn't tell you. I don't know what's in it.
Yeah. So consider the source, and we are the source. All right. This is going off to the other side, which we're seeing a lot of this, and a lot of patients are coming in. A lot of patients are coming in with complications. There's been several articles in the news about Botox, and not only Botox, but how sick they got after they got their Botox, and getting botulism, where botulism, is when it was a food poisoning and you would get paralyzed. So they were coming in with a lot of things, and it was just 2 articles that we pulled up on the internet where they're getting fake Botox. And not
Also
fake,
from China.
Also from China, which is, again, maybe ask. There's medical clinics like this, not even non-medical clinics, popping up, giving Botox, but what a red flag should be is when they're offering it for such an unbeatable price. You're not getting the Botox. It's either diluted way down, or it's stuff they're getting from China. There was a clinic that was arrested in New York, an esthetician that was arrested in New York because the Botox was coming from, her source was getting it from China. So, if you don't trust somebody, ask to see the vial and ask if they've diluted it. But you don't want to get botulism toxin or botulism, because that's potentially fatal. So there's a lot of fake things out there.
Botox,
Filler.
And can talk about also products from Amazon that you don't know, or TikTok. So
We have a lot of patients that we have consults about skincare, and we often get patients who tell us they'll purchase their products that we suggest for them on Amazon, Walmart, they buy them online. Oftentimes, these are not authorized dealers, so when they purchase these products, they cannot guarantee that these are genuine products. These are actually, they could be fake. There was, I think one lady told me she actually purchased a toner, and it was basically water in the bottle. So sometimes it's kind of like the knockoff purses and stuff. There'll be certain little things that are slightly different in the labels, in the packaging, that makes it to where they can sell it, but it's not genuine products. They're not authentic, and then they don't work as well as they should be. And a lot of the products that we order, we work with medical grade products. And oftentimes we have to have a doctor to sign off to get those products, which are all prescription strength. Like the tretinoin, hydroquinone, things like that. You can't get that on Amazon.
Yeah.
So, it's good. Now, Amber too, this is Amber, other esthetician. You too, both of you seen complications from fillers that were not approved fillers?
Honestly, in my experience, I have actually heard more of Botox being over-diluted to where it is not near as effective compared to other places.
I've been through this experience of Botox. It didn't do anything to me, nothing. I want to break even my eyebrow. I mean.
And you had Botox before, so you knew exactly what to expect.
It was good, but one clinic, and he is a doctor also. I mean, it didn't do anything for me.
So that brings up to the other thing is sometimes it's not, it could be legitimate Botox, but you've developed antibodies to the Botox, which happens with regular Botox. You can develop antibodies and then all of a sudden you're immune to the Botox, it's not working. I had that experience where I would get it and all of a sudden, like in a month later, I'm like, why is my face moving this much? You know, I don't like that. I'm like, why am I depressed? I get depressed when my Botox goes down, but also my face was like moving. I'm like, I don't want it to move that much, you know. I don't want to see these lines in my forehead. So Xeomin has another product out that's similar to Botox.
Which is?
What's that?
The name is
Xeomin.
Xeomin.
It's another
Botox. It was
just Dysport.
Dysport is similar to Botox.
I don't want anybody to do Dysport.
Right. It's two different things.
Botox I think is the best. He did Dysport and I asked him, please don't do Dysport. It doesn't do anything to my eyebrow.
Yeah. Well, mine stopped working. So I tried the Xeomin, and I got the Xeomin in November, and I just realized last week that my face was moving too much. It lasted that long. I think because I had developed antibodies. I was probably the first person in Memphis to ever get Botox, and I'm not kidding. I mean, I had to beg a plastic surgeon to do it.
And she was, I promise you.
Yeah. I was researching this stuff 20 years ago, and I had it in my face, and it worked great. I couldn't even squint if I was looking at the sun. I loved it. But then after time, it started it wasn't lasting as long, you know? And it was lasting maybe 2 months. Then it was a month. Then I said, well, something's going on. So Xeomin doesn't have the protein, I think it doesn't have a protein in it that causes your body to react with antigens. And when your body reacts with antigens to something, it sort of stops it in its tracks. Xeomin, it lasted, almost 4 or 5 months. So there are options out there, but there are fake Botoxes and very diluted Botoxes, just so you know.
And just like the weight loss shots, which she said you can look at the vial, you can ask your provider to show you the vial as well. That's not a secret.
And they should draw it up while you're in there because it has to be in the refrigerator.
It should be drawn, like they should do the whole thing right out of me, so.
And they should not be reconstituting it, meaning like if there's a powder in there and they're having to add liquid to it, no. So just be careful and ask all the questions, but your first clue is, why are they offering it so cheap?
Yeah, gimmicky things, Groupons. Sorry, we love them in some worlds, but not in our world. It's not.
So again, consider that source for your Botox and your fillers and there are fillers out there that they kind of cheat on by diluting them and you're not getting what you're getting. Trust the experts. Did I talk about 4 things? 1, 2, 3, 4.
Can we open it?
Can I add something?
Yes.
The additional thing that the in-face is something that can stimulate collagen in the face and stuff, and it can help diminish how long you may need to have a filler, and how potentiate, I guess is a better way to say it. As, you know, it doesn't work for everybody, that I can't say, but it is something that we have our estheticians
Like a Botox-like effect.
can do, and it has like a Botox-like effect that can, it's several sessions to do it, but it's a weekly kind of treatment to the face. And I know about myself, I know what happened when I used it and stuff, and I know these ladies also know that they have used it in other patients and stuff.
And we also have P-Tox, which you've seen. It's by SkinCeuticals. It's a topical that you put on your face, and it extends the life of your Botox.
Obagi has the
Yeah,
one or
and
two.
Obagi also
Don't
has,
close so the camera.
and Obagi also has Lift and Sculpt, which actually complements our M-Face a lot too. It helps with, as it states, lift and sculpting your skin. But I've actually seen great results with patients who are on M-Face, or who are receiving M-Face treatments and using the Lift and Sculpt product as well. I call it my filler in a jar.
Products have come along.
Yeah, and the PTOX, as you mentioned, is my Botox in a bottle.
Innovation.
So, again, on this, not to say that, we're gonna have a big party and a big announcement for all this products, but we have another one that is a device that acts as a filler as well for the face. So it's, I can't say it's a laser, it's ultrasound radio frequency, but it is a plumping. And so that's the key. So we're all about non-invasive, healthy options for not only weight loss, hormones, but also for aesthetics. So just keep that in mind, but look for our big announcement that's gonna come up for what we've got, and it's gonna be exciting. It's gonna be big, it's gonna be huge.
Amber has an announcement.
So 10% off any skin and laser products, packages today, and also weight loss management, same thing, the GLP-1s, 10% off today.
Oh yeah, that's a big deal, because,
And if anybody will have a question, it's open.
yeah,
questions
question,
are open.
anything.
I have one about, I didn't hear anything about the M-Sculpt Neo. Isn't that part of the weight loss management?
That
We
can-
can
yes.
package it, yes.
Yes.
Yes, and then she was talking about M-Face, which is sort of like M-Sculpt, but for your face. So it works on that.
Yeah, we do.
Yeah, it's called Neo. It's fabulous. It works very, very well in combination.
And, again, part,
Amber and do the actual, but they can combine it with the weight management
I'm not
product.
worried about the face.
no, but this is another thing is, we now have M-Sculpt and that device approved for functional wellness, meaning if you've got chronic back pain, arthritis, joint pain, we're applying it to that
Knee
now.
pain, yeah, any kind of knee pain,
We
yes.
do that. You want to touch on Emcella and?
Oh, yeah. So part of this whole thing, we now are, a lot of medicine now is going towards functional wellness. Functional wellness is, if you've got a problem, we don't want you taking a bunch of pain medications for it. We don't want you doing anything else. But we want to help you with a device that's going to help, keep you away from getting surgeries in hospitals and things like that, getting on gabapentin, getting on pain medication. So functional wellness means we're trying to keep you well and keep you healthy so you can enjoy life and exercise and do all these other things. But you told me to say something and I just got lost in my train of thought of functional wellness.
Is anything covered by insurance?
Thank you.
Absolutely not. And this is why. This is why I learned this from a meeting I went to. Why is all this healthy stuff that we're doing and everybody else is trying to do, health and wellness, why is it not covered by insurance? Does anybody know?
It gives you
What?
They'd rather.
We know.
Because it's a male-dominated system.
What's,
And they
well,
don't
that's
have
true.
They don't have the same kind of challenges that females have.
That's,
They don't want you to be well.
that's part of it. But no, you know why they don't want you to be well? Because they don't care, because United Healthcare is going to, you're not going to be with United Healthcare in 2 years. So why should they spend the money keeping you healthy when you're going to be with somebody else? So I heard somebody say that in a meeting. That's why they're not paying for prevention and wellness because they don't care, because you're not going to be with them in 2 years or 3 years. And so they don't care if you're unhealthy. You're going to be Humana's problem, or you're going to be Blue Cross's problem down the road. That's why they're not doing that. So, I mean, my hope is that somebody, besides somebody going out and shooting somebody, would lead a movement to actually do something about these insurance companies. They should be trying to keep you well, but they don't have your best interest in mind because you're not going to be with them, so why do it?
Yeah.
So, any other questions,
About any
concerns?
topic, you guys are open forums.
I've got a ducky horsey question, and I call it ducky horsey because, you know, and maybe everybody in here knows everything about the body and all that kind of stuff. I don't. So, you started out with hormones and pellets and this and that. What is all that for?
The hormones?
Yeah.
Quality of life, longevity. That should be enough right there.
Your brain.
Your brain.
You name it.
You name it. I mean, seriously. I mean, people look at me sometimes, they go, I don't want to take any more medicine. Hormones aren't medicine. I mean, you were born with hormones. You had hormones at 20, 30, 40, and then it started decreasing after that. So why not replace what you had 20 years ago? And keep yourself young and healthy.
I have been critically ill in one way or another for a whole lot of years with illnesses that they couldn't diagnose because I wasn't the right race or I wasn't the right sex or whatever. And now I'm in my early 70s and feeling probably the best I've felt in a long time. But the figure is now, I'm trying to figure out just what's going on inside of my body, since it seems like it's really healthy. And it's
Did you
never
do anything
been that
different?
way. I kept living and I kept fighting and I quit taking the meds I was being given.
So when you take one medication, you're bound to take another medication because that's causing a lot of problems. That's why we wish that we could get everybody off medications. And you can do that. Food is medicine. Your food and what you're putting in your mouth is key. What you're surrounding yourself with is key. I mean, look, is there mold in your house? Are you living by a polluted factory? What air are you breathing? What microplastics are you getting from your diet? Microplastics are huge. Do you know why? You can't get rid of them. Once they're in your body, they're there. So what plastics, microwaving, MSG, sugar, all these foods that are just ultra processed are bad for you, but people don't realize it because it tastes so good. It tastes so good. But once you wean yourself off of it, it'd make me sick if I tried to eat it.
So how do I go about getting tested to find out what shape my body is really?
Well, it depends on what you're looking for. Now, we have OligoScan, which is a scan that looks at the tissue levels of micronutrients and heavy metals and environmental stuff in your skin, which when your body can't get rid of something and it's overloaded, it deposits in your skin and your organs. So we have a test for that. We have a lab now that does mold testing to see if you've been exposed to mold, which is huge. People come to me and they go, they just feel so sick. And she went to Sims Murphy and they ordered a test for her for mold because she had all these neurological symptoms, but it had also other stuff. They blamed it on mercury. I said, look, your mold levels are high. That can be neurotoxic. Certain molds can be neurotoxic. So, you've got to look what you're living with and what you're surrounding yourself with. And now I'm telling you, Memphis is probably the worst air quality we've ever had because of what's going on at President's Island and what's going on too. I hate to say that, everybody loves Elon Musk and that XAI, but that's about to change our environment in a bad way. Bad way.
So the first step to a healthy lifestyle, make an appointment.
But we do all sorts of tests.
Yes.